Through the community-based outreach program at UT Health San Antonio School of Dentistry, I was able to volunteer and teach in several underserved communities throughout South Texas. These opportunities were available to me even during my first year as a dental student. Growing up in one of these communities, I had limited access to dental care as a child. I knew I wanted to change that for others. During my third year of dental school, I was able to provide care for patients at one of the school's community care partner clinics. I was able to understand what a career in public health looks like and how it was a real possibility for me.
Our School of Dentistry addresses the oral health needs of underserved South Texas communities through our extensive community-based education programs. These programs are embedded throughout the 4-year dental, 2-year dental hygiene, and advanced dental education curricula. More than 3,800 students have participated in these programs since their inception in 1984. Each year, students provide services to more than 36,000 underserved individuals with an annual care value of close to $8 million.
We understand there is a need for compassionate oral health care providers. That is why we are dedicated to engaging and educating students so that they have the necessary skills to take excellent care of the communities they will serve. In our community-based outreach programs, students receive important training and provide clinical care to pediatric patients, uninsured adults, prenatal, geriatric, refugee, and homeless individuals at sites across South Texas, ranging from as close to a local elementary school or clinic to as far as 267 miles from our campus.
Through the outreach program, we learn to have an open heart, to treat a diversity of patients, and to respect every patient who sits in our chair needing care. Working with the homeless population at Haven for Hope and the San Antonio Christian Dental Clinic, I saw that homelessness does not discriminate. Through treatment and alleviation of a patient's dental pain, I immediately see the difference I have made in their life. Dentistry should not be a luxury only for those who can afford it.
As a student at UT Health San Antonio, I was able to do 2 rotations at community health centers in rural Texas. I think that dental schools that provide community outreach rotations and opportunities for their students really serve the greater population. I think that oftentimes a lot of dental students don't recognize community dentistry as a viable career option, and so they can use the skills that they've learned, use their education to give back to people who could really utilize their services.
In addition to providing much-needed care to communities across South Texas, our community outreach programs address the need for dental professionals in health professional shortage areas of Texas. As a Hispanic Center of Excellence, we receive resources for the development of our pipeline programs to underserved counties. We recruit and mentor high school and college students for careers in dentistry. About 30% of our students are Hispanic, and we want them to return to their communities prepared to provide compassionate care. So far, it's working. UT Health San Antonio School of Dentistry graduates account for close to 40% of dentists practicing in underserved counties in South Texas. However, within the next 10 years, due to aging providers and population growth, we anticipate an even greater shortage. Therefore, our efforts must continue.
For schools such as UT Health San Antonio to provide them with that opportunity to go out, serve the community, see what kind of dentistry we do, see that it's real dentistry and valuable services to a population in need, then helps those students to go back and consider maybe that's a career option for me.
I've always had the desire to make a difference. With the education I have received at UT Health San Antonio, I now have the skills to provide care that would help make my patients' lives better.